Good afternoon, friends. I am Dr. Dheeraj Gupta from Blurry Hospital. I am a senior surgeon who specializes in cataract and Lasik surgeries. I have been working in Gurgaon for almost 25 years, having extensive experience of all types of cataract surgeries, including adults and children. I am here to talk about one of the commonest diseases that we have in the country with a huge backlog, and that is cataract. There are primarily two types of cataract, one which happens with age and one which is present at birth in children. But I am not going to discuss about the congenital or the childhood cataract. I am here to discuss more about the adulthood cataract, which is the common thing. Cataract normally happens with anyone who crosses the age of 50-55. But it is not necessary that it will happen at 55, it can happen at 50, it can happen at 60. Some people have it much later at 70 and 80s also. The only thing that one must remember is that if you are having a frequent change of glasses, please get them changed, and not from an optician, from an ophthalmologist, from an eye specialist, because an optician will not be able to tell you whether you have cataract or not. He or she will just change your glasses and you will be under the impression that my eyes are fine, which may not be true. So it is always imperative that you should get your eyes checked by an ophthalmologist the moment you cross the age of 45 or 50. Because we will also look at some other diseases in your eye and be able to guide the treatment for that. Now, the only symptom of cataract is blurring of vision. Initially, the number changes and you are able to see. But beyond a level, even the change of power cannot make you see clearly. That is when cataract surgery is needed. And today we do not want cataract to become more. We don't want it to mature. We don't want that it becomes so advanced that whatever surgery we are doing, a laser cataract surgery or a phacoemulsification, it causes more damage to the eye. We want that you should get the surgery done at the right time, at an appropriate time, so that your surgical outcome is very good and you have least amount of trouble and least amount of damage to the eye. Now, the laser cataract surgery and the phacoemulsification that we are doing today is at par with anywhere else in the world. And the results are so good that you will be able to see majority of the things from the very next day, even on the day of the surgery. The surgery does not require you to be admitted for the whole day. It is a few hours surgery. Don't have a big stay in the hospital, and the surgery is very comfortable to the patient. There are primarily three types of lenses that we use in cataract surgery. One lens is only for distance vision, where you practically do not need glasses for distance, but you will need glasses for near. Now, this lens is the most common lens which is put in everybody's eye, can be put in anybody and everybody's eye. But it is definitely useful for people who don't mind reading glasses or who want perfection in vision, because there will be no compromise in quality of vision if we put a monofocal or a single vision lens. But people who are doing both distance and near work, are not driving too much, and are not very keen to wear glasses, but also do not have too much of computer work, there are something called as bifocal or multifocal lenses. These lenses give you good vision for distance as well as near, so your requirement of glasses in day-to-day life goes down drastically. Now, there is another kind of lens, which is a third lens, where you can see both for distance and computer and near. All three things are available, which is equivalent to a progressive glass, which we normally wear after 40 years of age. And that will make you practically independent of glasses doing all three kinds of work. The only thing that requires you to choose the lens is a consultation with your physician, who would have a look at your systemic diseases like diabetes and blood pressure and the condition of your retina. If the condition of retina is good, then you can go for any of the three lenses. But if your condition of the retina is not that good, then the appropriate lens is advised by the ophthalmologist depending on your requirement and depending on the kind of lens which will be suitable as per your retina. So, and finally, I would say that the moment you have cataract, don't be scared of the surgery. Make an informed decision. Talk to your ophthalmologist. Come to us, we will be able to give you the best possible treatment and the best possible consultation to your total satisfaction. I hope you give us a chance to serve yourself. Thank you.